Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here with Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 9 additional deaths due to COVID-19, 1 from the Northern Health Region, 3 from the Prairie Mountain Health Region, and 5 from the Winnipeg Health Region. To extend my condolences to their family, friends, loved ones, caregivers. Our current 5-day COVID-19 test positivity rate is 10.1% provincially, 10.3% in Winnipeg. As of 9:30 a.m. today, 222 new cases of the virus have been identified. Total number of lab confirmed cases in Manitoba is 25,963. We know the critical level or red restrictions have been challenging. We've been asking Manitobans to restrict your life for 8 weeks, and that's certainly a long time. While we're seeing some difference to our numbers, we have been worried about a spike following the holidays. Yesterday, we announced that Public Health had attributed 60 cases linked to holiday gatherings. As we continue to look at that data and not just specifically look at holiday, the days of the holidays such as Christmas and Boxing Day, New Year, Kwanzaa, or Hanukkah, and we actually look at gatherings that took place throughout the holiday season on the 25th of December and after, we're getting a bit more detailed picture of the impact of these holiday gatherings. When we look at those numbers, we see 355 of our current cases linked to those holiday gatherings, with almost 1,900 contacts. And so we have gathering sizes that took place of more than 24 people. And so these numbers are certainly things we had to take in consideration when addressing these orders that are expiring today. Today we're announcing that we're extending the current public health orders until January 22nd. This will allow us to continue to protect Manitobans, to continue to reduce the case numbers, continue to ease the hardship in the healthcare system, and also continue us to follow the expected increased numbers due to these holiday gatherings. Related to the public health orders, we're only making minor changes, and those modifications we've discussed in the past. Currently, our orders allowed professional-based hockey teams to train in Manitoba and to allow athletes, affiliated officials, an exemption to the self-isolation orders. The updated orders will extend those exemptions to all professional hockey teams, so to allow games and training. Clarifications have been made to ensure all elements of gameplay, including administrative officials, broadcasters, scouts, etc., are covered in the order. And it's important to note that this is able to occur because of the strict protocols being put in place by the NHL. These have been reviewed by my counterparts in all affected provinces. Play is only going to be taking place in Canada for the opening of the season. And we've all reviewed those protocols and the testing strategy, and this is a quite low risk to Manitobans. So we have these new orders. They're going to be in place for 2 weeks. But we're going to continue to monitor these possible increases in case numbers as a result, largely of these gatherings that we know now took place over the holidays. But beginning next week, we're going to launch consultations with Manitobans for feedback on potential future changes to the orders. And that's, of course, if our case numbers allow. So I want to be clear that we have seen a good response to our numbers throughout the later part of December. And we see that translate into some improvements on the strains in the healthcare system. But we're not back at normal. And now, in fact, we see we're at risk of accelerated increase in numbers again. And so we're not really ready to make those changes. We're still at risk in our system. We still have strain on the healthcare system. Our numbers were going in the right direction, but now we're at risk of reversing that. And so we got to keep focusing on those fundamentals. We need to ensure that we're staying home when we're sick, even if mildly ill. So we're getting a lot of reports from the public health nurses doing case investigations of people with very mild symptoms being out and about and exposing others simply because the symptoms were so mild that they didn't feel it was worth doing anything for, but it resulted in a number of contacts. So any symptoms at all, go for testing and self-isolate. In many people, COVID can present, at least initially, very mildly. So be on the lookout for even mild symptoms, runny nose, sore throat, cough, fever, any of these type of things. Even diarrhea lasting more than 24 hours can be attributed to COVID. So be on the lookout for symptoms and be very cautious. Stay home with illness, get tested, and this will help us keep these numbers down. Again, if a person in a household is ill, they should be tested, and if they're waiting for a test, everyone in that household should be self-isolating pending that result. And then we know those are the fundamentals, right? Washing our hands, covering our cough, wearing a mask. These are all things that will keep trying to get these numbers down. So our positivity rates are too high. We still see hospitalization and ICU rates are still high, so we're still taxing our healthcare system with these numbers. And now we're concerned that we might see increasing numbers in the next few days to weeks. So now is certainly not the time for us to relax and let our guard down. So we'll keep working at this. We're going to engage Manitobans starting next week on our future plans, but it's all going to depend on what these numbers do. So thanks again to Manitobans, and I'm going to turn it over to Lanette.
Thank you very much. Good afternoon, everyone. There are 315 COVID patients in our hospital this morning. This includes 227 patients who actively have COVID, as well as 88 who are past that infectious stage but still requiring acute care. As of midnight, there were 101 patients in our ICU units, which is above our normal pre-COVID baseline by 29. This includes also 35 patients who have COVID or are past their infectious period but still very sick. 25 of the 56 patients who are on ventilators this morning have COVID, including 3 of them who are now past their infectious stage. I was also asked to provide an age breakdown of who are in our hospitals. So I'll just quickly give you that. From the ages of 0 to 19, we have 4 patients in hospital. From the ages of 20 to 39, there are 15. From the ages of 40 to 59, there are 43 patients admitted. From the ages of 60 to 79 years of age, there are 102 patients who are admitted to hospital. And from the ages of 80 to 99, there are 61 patients in hospital. There are also 2 patients who are over the age of 100 years old. The number of COVID-related hospitalizations appears to be stabilizing, and in some cases decreasing slowly, beginning to. And as we continue to refine our team-based staffing models, we are feeling like we are in a much better spot than we were weeks or months ago. As well, with the rapid testing technology that continues to be distributed throughout our system, the PPE inventory that continues to be fortified, and the vaccines that are starting to move out and prioritize our healthcare workers, we are feeling cautiously optimistic that we are at a point where we can begin resuming some of our elective surgical procedures starting next week on Monday. at Misericordia, Concordia, Pan Am, and Health Sciences Center. This will be a very small increase. There'll be about 60 surgical procedures that will happen across these 4 sites next week. And surgery programs in Southern Health, Santé Sud, as well as Prairie Mountain Health are currently looking at their capacity and whether there's opportunity for them to also begin increasing the surgical activity. The 11-week slowdown that we have just endured is like nothing that we've actually ever seen prior to this in our system. So it was necessary, however, because when we saw the surge of COVID cases, the increased hospital admissions, it was necessary to deploy our staff to help where the highest priority needs were. And during this time, urgent, emergent, and trauma surgical cases did continue to happen. And within the Winnipeg region alone, there were 6,100 surgical procedures that still happened in this time because of their urgent nature. However, there were almost 6,000 cases, elective cases, that were deferred because the staff had been redeployed, and that was since October 26th. There was 5,900 cases that were delayed. So the procedures that will occur next week are going to be prioritized. There'll be a mixture of orthopedic procedures, including joint replacements. There will be eye surgeries happening, retinas, as well as some long-waiting cataract cases, and other procedures that are very important to people's quality of life. The small number of staff that we will require to complete these surgical procedures have been notified and that they will be returning to their home units from being previously redeployed. And I do just want to thank the staff for your dedication and your commitment. And I know this was very disruptive, but you continue to make sacrifices and help people in Manitoba to meet the needs of the system. So I want to sincerely thank everyone who's been involved in it and continues to be involved in it, because there's still lots of people who are redeployed. Our plan is to gradually increase the surgical procedures happening, but also at the same time watch very closely what's happening with the active case counts, the number of contacts, and the number of hospital admissions. So we have to be very cautious in our approach and make sure that we are able to meet all patients' needs throughout Manitoba. So I want to be clear that this is not a return to normal, but it is a positive step in the right direction. And we do appreciate that everyone is so tired of COVID restrictions and want to return to their normal lives, to be with family, to be with friends. And unfortunately, we're not there yet. We need to continue to follow these public health restrictions. We need to do everything we can as individuals to keep the spread of this virus to a minimum, so that the more we can do that, the sooner we can get back to normal. So I also want to provide an update on the co-visitation shelters that have been established for the personal care homes so that social visitation can occur with loved ones. Visits with loved ones by designated care providers have continued in the personal care homes throughout the Code Red restrictions. These shelters, these co-visitation shelters, will allow additional visitation to occur. At this time, 98 of the 105 external shelters have received their occupancy permits, while an expected 54 out of 57 who have designated indoor spaces will receive their permits in the next week or two. Approximately 75 care homes have indicated their shelters will be operational as of mid-January. And these shelters are part of our ongoing efforts to balance that prevention of spreading the virus with the compassion that we need to keep the human spirit going. So we will continue to do all we can to get through this virus, and just a thank you to everyone who's with us on this journey, and we'll continue on. And with that, we can open the line to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and two follow-up questions this afternoon. Up first, from City News, Jonas.
Good afternoon, folks. First question is for Dr. Roussin today. Dr. Roussin, I just want to circle back on these numbers over the Christmas break. What I'm wondering today is, how does this compare to what happened around Thanksgiving before we really hit the worst of things in the fall? Is this similar to what we saw around then? Is it worse? How can we compare that?
Yeah, so it's a similar pattern where we saw increasing, increased gathering and a number of cases linked to it. I don't know if if I saw the exact numbers over that weekend of the amount of cases that went. Certainly, it's a relatively shorter period of time. But what we're concerned about here is the sheer number of cases, but more than that, it's the number of contacts. So we have 1,900 people right now, and that's always going to be an underestimate. 1,900 people who have been exposed to known cases of COVID who could be incubating that virus right now. And so we know that through most of the waves, about 14% of close contacts become cases. And so there's a large number of people at risk to turn case.
As a follow-up, what we learned from post-Thanksgiving into Christmas into November, what can we apply to this moving forward?
Well, I mean, I think what we learned was to apply going into it, right? And that's why we had all these tight restrictions and messaging going into these holidays, because we know that gathering is what puts us at risk of transmission. I've said this before. It's like there's nothing right now about this virus that surprises us. We know how it's transmitted, and we have orders in place. We have messaging in place to minimize that. And so we've seen large outbreaks happening in communities where large funerals took place. We're going to see a spike in cases now because there is increasing gatherings over the holidays. So there's nothing that's surprising about this, and so we message, we have orders in place, and so right now what we can learn is not as much right now, is that we have to ensure that those 1,900 people are going to appropriately self-isolate for the complete 14 days to minimize that transmission chain. But it's really, none of this is surprising. When you gather, we're going to see this virus transmitted.
And as a final question, I guess just a message to businesses, to folks that were hoping for some change today.
Yeah, I mean, I think everyone is hoping that COVID would go away and that we don't have to deal with it anymore. But we can see these numbers. While up to now we've seen a good tracking of our numbers, right? Certainly the right direction. We've seen quite a change in the trajectory in December when we were on that worst case scenario, and it just shows that these restrictions work. Right, we can see it everywhere. Where, we see cases climbing in other jurisdictions when restrictions are put on. It works, and we're just now getting back to some surgery, and without the restrictions we wouldn't be able to do that this week. We would be many weeks, months away from that, and so it's just everyone wants to get back to their normal lives, but we just don't have that option right now. We have to deal with this pandemic. We have to ensure we don't overrun our healthcare system. We have to ensure the healthcare system is there for everyone who needs it. That the healthcare system isn't there just treating COVID. So, I think we have hope. We have the vaccine, and we had our numbers in the right trajectory. We know it works when we follow along, and we're going to review this. We're going to engage next week. We're going to review these orders as early as 2 weeks, and so we're really hopeful we could at that time start loosening some of these.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, why did we wait so long for these orders, only for them to not really change?
Yeah, I mean, we knew that the timing was difficult, having them expire sort of right in the middle of the incubation period after the holiday season. So we were watching those numbers, right? We were at a good trajectory. Right up until the last number of days, we were seeing our numbers come down as expected. We were seeing some good signs in the healthcare system, and so we needed to follow that trend. And so, in the last number of days, we're getting more and more cases linked to holiday gatherings, seeing more and more contacts, and it just became quite clear that we just weren't going to be in a position to substantially loosen these orders.
I know when these orders first started to come into effect, it was supposed to be a short circuit breaker, which is what helped a lot of Manitobans, accept the stricter restrictions. But now, for a good portion of this pandemic, we've been under them, and Manitobans are really struggling. Why should Manitobans continue to have faith in the orders?
Yeah, well, I mean, I think it should be very clear that they work, right? We were on the worst case trajectory when we showed you our modeling data, that we were set to have 1,000 cases a day in early December. We put these restrictions on, as difficult as they are, and we're down to under 150 cases last week. So they absolutely work, and we've had a lot of our healthcare system slow down. We're just right now, next week, because of these orders, starting to get back to some surgery. That's nowhere near getting to the backlog. Right, and it's just we're just now getting back to some of this. So if we let up now, we're at risk of again overwhelming our healthcare system, and we're at risk of again requiring it to slow down and provide care for the most part only to COVID.
And I think it's fair to say a lot of people are facing some substantial mental health difficulties as a direct result of these lockdowns that a phone call or a walk outside aren't really going to fix. What is the province doing to reconcile this?
I'm sorry, were you asking about mental health issues?
Yeah.
Yes. Yeah, so, there are resources online. So I suggest going to manitobahealth.ca/COVID-19 and looking at some of the mental health resources that are available there. Again, we encourage all Manitobans to stay in close contact with the healthcare providers. There's virtual visits, there's in-person visits. If you require medical care and support, it's safe. So please access that. So please contact your primary care provider if you're having any issues. And we know it's difficult, but the alternative is to overrun our healthcare system, to not be able to provide that care to Manitobans. So while very difficult, these restrictions are necessary.
From the Winnipeg Free Press, Larry.
Dr. Roussin, I just want to follow up on previous questions about why waiting until the very last moment to update the orders. Were you monitoring the gathering of the cases as a result of gatherings, or was it overall numbers? And did you have a couple of different scenarios you're ready to act upon depending on what these last-minute numbers told you?
That's right. So I mean, it's a mischaracterization to say we're waiting to the last minute. We've been working on what these orders could look like for weeks, right? But you're right. We were monitoring. We knew the risk over the holidays. We knew we had orders in place. We knew we had strong messaging, but we knew despite that there was a strong risk that a lot of people did gather, and so we were waiting for as long as we could to get that signal, and then now we saw that signal quite clear that there was a lot of gathering that occurred, that we have a lot of contacts right now, and that we're at risk of seeing increased cases. So we just weren't in a position, but like you say, we did have scenarios mapped out that if our numbers would support it, then we had a path forward.
So if there had been fewer or very few gatherings over the holiday season, would we have seen maybe some easing of restrictions today?
That was the plan, was that if our numbers supported it, I mean, that's the plan every time with all these set of numbers, right, is we want the least restrictive means necessary. So anytime we feel the numbers support it, we're going to start pulling back on restrictions. And so absolutely, if we saw the right numbers, the right trajectory, without really a substantial risk that we're waiting on, we were prepared to have some sort of loosening of the restrictions.
My last question is for Ms. Siragusa. You gave us the size of the backlog of elective surgeries for the last 11 weeks, and I'm wondering, was that just for that 11-week period, or can you tell us what the total backlog in elective surgeries has been since the start of the pandemic?
Yeah, since the start of the pandemic, as of course you know, Larry, we also had a slowdown in the spring, and that saw about 5,300 cases that were delayed. So what we do is we do a year-by-year comparison. So if we look at the comparison of surgeries done in 2019 compared to what was 2020, we think that it looks like it's around 5,300 cases were delayed. We worked really hard in the summer and the fall to try and catch up on those numbers, so continue with our baseline plus additional. So I think we ended up being about still 5,000 cases behind from the spring, plus now 5,900 from the fall, 11-week slowdown. So our plan is to slowly and cautiously get ourselves up and running again to normal baseline. At the same time, we will be planning in parallel to look at how do we address that backlog in the coming months and longer if that takes, but we'll be working with our surgical team and trying to address that.
From Global News, Malika.
Hi, this message is for Ms. Siragusa. Just based on that and what we're looking at for the delays, what about for other centers? So you had mentioned 4 centers we're going to start for next week and then look at the numbers. Other centers in the city like St. Boniface for surgeries, is that on the list if the numbers go down? How is that working?
Yeah, absolutely. The Grace and St. Boniface, as well as HSC and Brandon, are sites that have critical care. So we do need to make sure that we maintain capacity there. So depending on what the numbers do, if they stay stable or they start to come down, then we do want to start surgery as soon as possible at those sites. However, they are busy units in their critical care, and they are mostly staffed by surgery team nurses. So we will have to watch and wait what these active cases do. Are we going to have another surge? Are the bed bases going to come down? And then when we feel that it is safe and stable, then we will start opening at those sites as well. Surgery at those sites.
Okay, thank you. And then this message is for Dr. Roussin, or this question, I guess. With the same restrictions being extended right now for the next couple of weeks, will you be looking at extending remote learning as well?
So we haven't had anything off the table when we're looking at it. The plans right now are to proceed. But we'll continue to follow these numbers. We'll see what sort of trajectory we get from as a result of these holiday gatherings. But like we've always mentioned, there's the benefit of having kids back in school in person, and we have a lot of safeguards in place, and we haven't seen a lot of transmission in that setting. So, in saying that, we'll always follow the numbers, and we'll continue to review our plans.
Okay, just based on that with transmission from settings, were we seeing that there was a lot of transmissions from settings in like smaller business shops as well before, when we saw the raised numbers in October, November, December, our spike, or was it mainly from gatherings and the transmission from gatherings?
Well, it's it's both. We saw in the early parts of the second wave, we saw a lot of likely transmission in restaurants and bars. We saw it in some retail settings, and then we also saw it in a lot of gatherings, right? And so some of it is difficult when we have a lot of community-based transmission. Then when we're investigating that case, we look at all the places they had been at in the acquisition period. So often we can't say this is exactly where they got it, but we could list a number of places where they potentially were exposed. And so the thing with this, with this virus, the high risk settings, right, are enclosed spaces, prolonged contact, crowded places. And so anytime we see that, that's very high risk. And when you look at acquisition overall, and this is true of any jurisdiction, is that it's widespread. There's not just one place that we see transmission. It's widespread. It's 5% here, 10% there, 8% here, and that's why when you see a lot of community-based transmission, we can't really take that targeted approach because it just transmission is occurring where anyone is, especially prolonged contact indoors.
From the Brandon Sun, Michelle.
Good afternoon. My first question has to do with someone who was hired here to do clerical work at the Brandon super site. They say they were initially promised everyone would be vaccinated, but apparently that's been changed to include only people giving the injection. Can either of you explain this?
No, I don't have details on that. We'll have to direct that to the vaccine task force.
Thank you. Further to that, in light of the fact that group gatherings seems to be right now to be the most responsible for the numbers we're seeing at the moment, has consideration been given to opening up shopping so that small businesses can open and sell and perhaps survive the pandemic?
Well, consideration, absolutely. So we've been looking at a number of scenarios, and so we're considered a number of options for this set of orders. But like I said, our numbers and the result of the gatherings over the holidays makes us quite concerned that now is not the time to open things, that we need to follow these numbers a bit longer to make that decision. And then you remember that a lot of the numbers right now related to gatherings is because everything else is closed, right? So when you open up, then a proportion of that will move from gatherings to other places, right? So it's just we've seen this before here, we've seen it before in every jurisdiction, and we see it again. Is that the restrictions work? When you open things up, we'll see numbers increase. Everyone's working hard to prevent that, but it's just the nature of this virus. And so when we see a lot of community-based transmission, we have to limit where people gather. And so right now we're going to have to still see the effects of this holiday season. We're going to extend this 2 weeks to get a real good idea of that. But the plan is always to have those least restrictive means so that we can get businesses open, get Manitobans back to the things they love, but at the same time having a healthcare system there for everyone.
Okay, thank you. My final question is, will different response levels be considered for different health regions? Is that ever going to be on the table again?
It can still be on the table, so we'll consider that as we move forward. I think it's really difficult to do that when there's when there's an area that's restricted, especially if it's Winnipeg that's restricted. It's very hard to have a loosening of restrictions and right in a neighboring region for a variety of reasons. But we're certainly looking at that. We always wanted to have a targeted approach. That was our plan. That was the pandemic response system. But we tried that early on in the second wave, and we just didn't get the results from it. And so that's why we find ourselves where we are now. But we definitely want to use the least restrictive means that still protects Manitobans, that still protects our healthcare system.
From CJOB, Clay.
Good afternoon, everyone. Dr. Roussin, I know you're disappointed with the latest numbers when it pertains to people obviously gathering during the holidays. But in your own words, can you tell me, despite all the warnings, despite the pleas, despite you're urging people not to gather during the holidays, and obviously they still did, despite the threat of fines, it still happened. What's your thought?
I think my thought is what I mentioned, earlier on in the second wave, is that we know this virus. We've, all Manitobans and people around the world understand this virus now. We've been dealing with it for so long. We know how it's spread, and we continually let it off the hook, right? So we had very good numbers going into the holiday season, and if that trajectory continued, we'd be looking even better than where we are now, and we'd be able to get back to a lot of things we want. But we couldn't make it through the holiday season, and again, it's not judgment. It's difficult times, right? And we're at this. I met with the special advisory committee the other day, and it's we've almost been meeting a year now on this committee. So everyone's been dealing with this for quite some time. So we know it's challenging, but we have to find ways to get through this. If we can avoid the things that we just know transmit this virus, we can be in a much better place earlier.
Have there been any individuals that have been identified who did flout the regulations and did gather and subsequently are now ill or may have passed it on and are fines forthcoming?
Well, I mean, these, this 355 cases linked to gatherings, those are all linked to that. So those are individuals, and then those 1,900 contacts are all exactly that. Those are related to gatherings that we advised against and have orders against. And so far as the fines go, we provide that weekly update on enforcement. There's certainly an opportunity for that, but it's a relatively high number of Manitobans that did gather. Again, no doubt, without an intent to transmit this virus, but it's just you can't avoid this virus when you gather. When you gather, this is what we see.
Okay, one last quick question. On Monday, the province rolls out the vaccination program to some long-term care homes. Are you hoping or do you expect that to go smoothly?
That's right. So we want the vaccination programs to go quite smoothly and expeditiously. We know that this group has been our highest risk group for severe outcomes. And now this vaccine's allowing us to protect some of our most vulnerable Manitobans. So the vaccine task force has worked out a great plan. We know we have great people that are working in those institutions, and so we're expecting this to roll out smoothly, and and get protection to our most vulnerable Manitobans.
From the Winnipeg Sun, Scott.
Good afternoon to both of you. Dr. Roussin, you just spoke of not letting the virus off the hook and not letting the restrictions and all that off the hook. We've already seen 3 government officials, flout the rules and travel. They were let off the hook. I have my doubts that 355 people, all these people, or even up to 2,000 people are going to be fined for gathering. It seems that we're letting people off the hook for flouting the orders by not, I don't understand. Like we've messaged, you guys have messaged. There's been threats of enforcement. People aren't allowed to gather yet. 350, up to 2,000 people did that, I suppose. What else can be done? And when are you guys going to be serious about sending an actual enforcement message to people other than just threatening it?
So I mean, we've been serious from the beginning. Any order, any restriction on on Manitobans is a serious thing, and we take that seriously. It's not as simple as just enforcing, every action, right? We have somebody who is a positive case, and we investigate, and they were at, say, a gathering with 24 people. Well, we get to those 24 people, have them self-isolate. We've now reduced the risk of that transmission chain. If we find that person, maybe the next person doesn't tell us about that gathering they had, and we can't get to that 24 people to self-isolate. Right, so there's a lot of things to consider. So we definitely enforce, we're definitely serious about it, and we have enforced it, and we continually will. But it's not as simple as just enforcing it every single time, because we need buy-in, right? We're not going to be able to get through this unless we have buy-in from Manitobans. And it's a real challenge for all Manitobans. It's a challenge for Manitobans who didn't go visit their loved ones. To hear that, thousands of Manitobans, did. And so I understand that, and it's, pandemics are a challenging time.
Thanks for that. But do you expect upwards of 2,000 people to self-isolate and follow those rules when those very same people wouldn't follow the gathering rules, though?
So this is the some of the nature of the enforcement, right? So when we have somebody who is to be isolating, who violates that, that's where I'm much more supportive of immediate enforcement. Right, so we've advised somebody that they are required to self-isolate. We've advised them what that entails, and so people who don't self-isolate when they ought to put other Manitobans knowingly at risk. And so those type of things I do think we should enforce when we see that, with exceptions. There's certain people that self-isolation is much more difficult than many of us. But for the most part, if you are advised to self-isolate, we are expecting that to be done and done in the proper manner.
Thanks. And my last question is, we're essentially asking 1.3 million, 1.4 million people to do the right thing, and it appears that most have, but it's 2,000 people that ruin it for the rest of us. Again, and then going back as well to government officials essentially being let off the hook. How do you expect people to keep on, sticking with what you guys are saying when it just seems that even if 1 or 10 people do it, it ruins it for the rest of people. How do you keep people on board here?
That's part of the challenge. Pandemics are difficult, right? And we'll see that we've seen people who have lost loved ones to this pandemic. We've seen people lost loved ones during the pandemic, and then they've been unable to mourn in ways that they wanted because of our restrictions on funerals. We've seen people lose businesses to this. And so it's really challenging times during the pandemic. And so I think that, but in many ways, it's brought us together as a province, that we see that together is the only way we can manage this. And so we've seen many gestures of kindness, of generosity during this pandemic, and then there's been mistakes, like we all make. And I'm sure that the people right now are who are cases, and I hope none of them are severe cases, but I'm sure there'll be second thoughts about having those gatherings. So I think we just acknowledge that pandemics are a difficult time. We've all made mistakes, and we're all trying to get through this together with the minimal impact on our health, the minimal impact on our economy. But it's a challenging time, and we're not at the end. But we do have hope. That vaccine is hope. The numbers that we saw, the trajectory of our numbers coming down since December, that's hope. So I just would encourage Manitobans to continue to hang in there, to continue to work with us, which the vast majority are, and we're going to see the end of this pandemic.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. A question for you. It's Gavin from Radio Canada. since First Nations people and care home residents represent sort of a disproportionate account of hospitalization, do you expect that the vaccination campaigns that are starting this week and the next will sort of rapidly change the hospitalization rates in Manitoba?
So this is certainly something to consider in quarter one, or even in the first half of 2021. We're not going to see vaccine numbers that's going to get to what we call that herd immunity, where we're protecting the entire population. We're not going to see that. But in saying that, we have the ability to influence things like our case fatality rate. The amount of people who have severe outcomes. We have the opportunity to affect our hospitalization rate. If we can vaccinate a significant proportion of those highest risk Manitobans, then yeah, we'll still see cases, but we could have an impact on the severity.
Are you seeing different trends in the numbers related to gatherings in different regions? For people seemingly gathering more, say, in the south than in the north, or that sort of thing?
Well, we've seen it in all regions. That 355 cases, I don't have a breakdown in front of me on which regions that is, but I know it's impacted every region we have.
Lanette, a question for you. The changes to rules about staying home, will there be changes to rules about staying home when you're sick for healthcare workers once they have been vaccinated? Are there going to be kind of new protocols that will come out of that?
Yeah, we're looking at that. Not all our staff are immunized, obviously, but we're working with occupational health to determine if there are any changes. At this point, no. Also, I would say no changes with PPE, even if you get vaccinated. But as more people get their immunization and we're getting more evidence and information, we will change our protocols as we can and keep everyone posted.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. Here's an oldie but a goodie, refreshed by even newer roundup of literature on infection rates among kids 16 and under, children and early teens. Seems the consensus is now that they're just as likely to get infected as adults, but they are less likely to be symptomatic. You've been asked this before, but seeing that there's an even growing body of evidence, how does this approach your decisions about schools and whether to keep kids in school?
So, I think as evidence grows, we continue to follow it. We, have a lot of experts that advise us on this. I think that we've said the 10 and above, that group, and the teenagers are probably just as likely to acquire the virus. Certainly much less severe outcomes in that group. The younger children, there's always mixed information. They still have a lot of evidence out there that the risk of transmission in those groups, or the younger children, is still less. And then again, what we've actually seen here, we've seen a lot of cases in school-age children, but despite that, we haven't seen a lot of transmission within classes. And so we'll continue to follow it. We continue to follow our numbers, right? Our numbers coming down when we were seeing into the low 100s. Well, that's setting us up to loosen a lot of restrictions. That's setting us up to keep the kids in school. But now this climb in cases, we'll have to watch it closely.
Yeah. So given the test positivity rates are still high, why not leave the older kids at home a little bit longer while they're already out?
Yeah, and like I said, nothing's off the table. We haven't made that decision at this point. We're going to see what these numbers do. We know there's a lot of benefit, and we know that the educational institutions have done a great job at protecting their staff and those students. And so there's a lot of safety protocols in place. And so if our numbers suggest it, then that's an option. Right now, we haven't made that decision.
Fair enough. The province's initial projections for vaccinations are 70% of the eligible population by the end of the year with Moderna or Pfizer. After that, the Prime Minister came back out this morning and continues to say everyone's going to get vaccinated by September. Also, we've got new vaccines probably going to be approved. Where do you think the truth lies in between? I mean, your best estimation, we're not going to hold it to you for the end of the year here because it's January, but what do you think is a more realistic goal to give Manitobans in terms of what percentage of us are going to get that full immunization this calendar year?
Yeah, and so there's a lot of variables there, Bartley, right? So it depends on the supply of vaccine right now is the biggest thing. You mentioned a number of other vaccines that are in the works to be approved, and most specifically the AstraZeneca vaccine, which has the typical storage requirements, so we can get that vaccine out to many providers. And so it really depends on the supply. So I do think it's and then also the uptake. We're talking about 70% of Manitobans, and certainly we want to see 70+% of Manitobans get this vaccine. And I would say that by Manitobans, we should be looking at fall, a fall of next year, that any Manitoban who wants the vaccine should be able to get it.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. I was wondering, I know I asked this a lot, and it's micro-level data that might not be at your fingertips, but in this most recent spike of cases, when you talk about gatherings over the holidays, are you seeing it mostly from small gatherings, people getting together, for a couple coming over for a dinner or something, or are you seeing it in larger community gatherings?
Right, yeah. So these are more gatherings within residences, and so the largest gathering size, and there's more than one, is in about the 20s, about the 24. So I would say there's a mix. There's just smaller families getting together from other households. There's multiple households getting together. There's larger families getting together into the 20s, and so we're seeing all sorts of this. So it's difficult for people to perceive sort of population level dynamics, right? So like to have one household visit another, often people perceive that as very low risk. It's just one household going there. But when you see thousands of households visiting thousands of other households, you put Manitobans at risk. So it really relies on everyone to buy into this, to know that we needed to get through this holiday season to help us look at next holiday season in a much different manner. So we have to be cautious. We're going to follow these numbers and see what that spike is, but we know we've been put at increased risk by the gatherings.
Thanks for that. And a couple of questions on the NHL decision. When did you first hear about the all-Canadian division idea, and how much more comfortable does that make you versus crossing international borders?
So I can't remember when the first time I heard it. It was certainly in the last calendar year, and I mean it's just a no-go, right? If the season entailed travel from a country with a much higher transmission going on, that was just a no-go. So it was a requirement of public health approval here that it would only be at this point. The regular season would only be in Canada.
Okay, and finally, the NHL is being allowed to play games in Canada, and you referred to strict measures that they're putting in place. We're not clear on all of them, but everybody seems to be in the consensus that there are strict measures. But other levels of sports aren't on right now. Do you understand how people might be a bit frustrated if they have children who are in sports?
Well, I mean, I think people are frustrated right now, right? Somebody who's a small business owner is frustrated. Somebody who wants to go visit their parents is frustrated, and likewise, children who want to get back to their favorite recreation are frustrated. So I think that we have to really see the difference, and I don't think it's that difficult to see a difference when you look at an organization such as the NHL, the protocols that they can have in place, the daily testing that they have in place, that these players do this only for a living. So I think that the difference is quite clear compared to what the NHL could do to an 8-year-old recreational hockey league. So nonetheless, it's a frustrating time. We've said it time and time again. These are challenging times, but the NHL put a proposal forward that really had such a robust protocols that really had such a minimal risk to Canadians that we felt that the benefit of getting back to or seeing some sort of normalcy during this stage was outweighing the quite minimal risk to the population.
From CTV Winnipeg, Jeff.
Well, hi, Dr. Roussin and Mr. Siragusa. My first question is for Mr. Siragusa. How many surgical staff are going back?
I didn't get a tally on that. 9, sorry, my person here. 9 staff are going back to support those 60 surgical procedures in the next week.
Thank you for that. And back to Dr. Roussin. Now back to, if I could follow up with some of Steve's questions on the NHL. Is the province prepared, and I assume, I know the province has the authority, prepared though to shut things down if, say, COVID cases did get to a level within the Canadian division where it'd be like, okay, that's it, we're shutting this down, we're not allowing the exemption?
Well, we will do what we need to do to protect the health of Manitobans. And so, there's no exemption that in any of our orders that can be that has to be definite. If we saw that there is risk to Manitobans, we're going to do whatever we need to protect the health of Manitobans. That comes first.
And lastly, we spoke with a business owner yesterday who said, I don't care what the province decides today, I'm opening up. I don't, basically I'm taking the risk of getting fined because I feel he's going to lose his livelihood. And he says he feels, he's talked to other businesses, he says he thinks they're going to do the same. Is the province maybe more prepared for that now that we're into the next year and it's been 8 weeks and we're another 2 weeks, that you might see businesses open and defying the order, or do you think it's very potentially isolated?
Well, I mean, I think we've been prepared to enforce the orders and have been enforcing them. I certainly feel for that individual, being put in a very difficult position by this pandemic. But I think it should be clear on why we have these restrictions, and it should be clear that they work. Right? We've been through this. We've seen them work, and now we see why our numbers are going up because of non-adherence to these orders. So. My advice is to follow these orders, to ensure you're accessing any support that's available out there. But people who defy these orders that put the health of Manitobans at risk would be subject to fines.
Our final reporter this afternoon from CBC National News, Cameron.
Hi, Dr. Roussin. Let's just finish up with hockey here. My apologies, I haven't seen the formal orders myself, but going off the press release, it doesn't say NHL, it says professional teams based in Winnipeg. So is that to assume this includes both the Jets and the American Hockey League Moose, and could it potentially include the Western Hockey League?
So as of right now, it includes the NHL. And so we reviewed some, the protocol as well from the AHL. And so we don't have a specific comment on that at this point. But so as of right now with these orders, this is only going to pertain to the NHL. There isn't any other things planned. But we're always reviewing those protocols, and we'll have more to say on that.
Well, given the AHL's affiliation, I mean, here it's owned by the same organization. Has the AHL approached the province of Manitoba yet with any sort of plan, or giving you any indication that one may be forthcoming?
Yeah, the plan is really identical to that of the NHL's, and so it's quite robust as well. And so it's just the timing right now is not something we're going to be commenting on, but also a very robust plan.
You mentioned the morale potential that perhaps seeing the NHL and seeing the Jets play may bring here in Manitoba. Don't know if you're a fan yourself, but any predictions on who's going to win the Canadian division?
I won't comment on that.
Thanks, everyone. This concludes our afternoon media briefing.